Hello, my name is Martin Esposito and I'm the Clinical Effectiveness Lead for Major Trauma for the Scottish Ambulance Service. As part of the updated guidance on the management of tension pneumothoraces, the insertion technique for needle chest decompression has changed. The aim of this short video is to demonstrate or walk through the updated technique. We're now going to go through the procedure in real time, and once that's complete, we'll go back through it in stages. The first stage is to ensure you have all the appropriate PPE and have all your equipment ready. For this procedure, I have hand spray, gloves, an alcohol swab, syringe, saline, tape, access to a sharps bin, and depending on the size of your patient, an ARS needle or a 14 gauge cannula. The next stage is to identify the correct site, and our preferred site is the second intercostal space mid-clavicular line, and it's worth noting that this is often more lateral or to the side than it looks. In male patients, this is almost certainly going to be lateral to the nipple line. There are generally two accepted techniques for locating the site. You can either find the angle of Louis, which should be level with the second rib. The space below that would be the second intercostal space. Or you can locate the clavicle. The first rib should lie directly below this. You would then work down two intercostal spaces to find the second intercostal space. Once the site is identified, you need to clean the site. The alternative site for this procedure, with a cannula only, is the fourth or fifth intercostal space, 1 to 2 centimetres anterior to the mid-axillary line. So to find this site, you would use the same technique as before. So identify your second intercostal space, then you simply work down 2 or 3 more intercostal spaces and then follow the rib down into the mid-axillary line, and then you want to be 1 to 2 centimetres just anterior to the mid-axillary line, and this will be the site for the needle chest decompression. Okay, we're now going to go through the process in stages. So once we've identified our site, we're going to clean the site. Whilst that's dry, we can assemble our equipment. So we're going to draw up 5 to 10 mils of saline in a 10 ml syringe. Then we're going to attach the syringe to our ARS needle or cannula. Now we're going to re-identify our site, and then at 90 degrees to the chest or perpendicular to the chest, we're going to insert the ARS needle or cannula. And whilst inserting, we're going to draw back on the plunger. We should get some bubbles or a give on the syringe. Once that happens, you then simply extend your catheter over your needle very similar to what you would do with an IV cannula. Then you withdraw your needle, take your sharp away. The next stage is to secure the ARS needle or whatever the catheter you've used. Now this may vary depending on the condition of the patient or the environment that you're in. But in this case, I'm just simply going to use a piece of tape.